In the previous video, we discussed about what are the types or stages of CML. So today we'll discuss as to what is the treatment of the phase 1. We know that this is a blood cancer and blood cancer needs treatment. But with the advances in the last 20 years that has happened in the treatment of CML, we have now progressed to something which is a myelosuppressive therapy to something which is just targeting the gene. Now in CML, the gene which is progressing or making the cells to grow unlimitedly is the Philadelphia chromosome in medical terms, which is translocation of chromosome 9 and chromosome 22 in between themselves, which gives the gene independence of the control of the cell production in a body. So that is why they have n number of cells producing in a body. In today's era, whenever I counsel a CML patient, I tell them, you have the best cancer in your body. So they get amazed looking at me. Doc, what are you saying? I have cancer, but you're saying it's the best cancer. Yes, mark my words. The first phase or the CML CP is one of the best blood cancers to have because we make it more like anything the way we have the metabolic disorders like diabetes or hypertension. Now, even if you have diabetes for a few years, you start treatment after the detection, you bring it under control, you follow the guidelines and keep it under control and can lead a normal lifespan. Similar phases have occurred in CML. With the advent of the targeted therapies like imatinib, dasatinib or nilotinib depending upon the hematologist or medical oncologist with the comorbidities that you have in the body, they'll prescribe you either of these medications which you have to continue for the whole life, and you can bring it under control with monitoring the fish for BCR-ABL which was at diagnosis, then by quantification test like RQ-PCR which is done at 3 months, 6 months, if required repeated at 9 months and then at 1 year, and if you have achieved the international targets which are there as per the guidelines, then it is then monitored annually for your whole life. Now, without the advice of the medical doctor which is treating you or the oncologist, you shouldn't stop the drug. The way you missing a blood pressure medication, your blood pressure shooting up, you're missing a diabetic pill, your diabetes going up, or your sugar levels going up. Similarly, we are suppressing the gene here by the targeted therapy. If you miss a number of tablets or even few tablets per month, then you'd give a chance for development of resistance to that tablet in the cancer cells and can sometimes progress to the next phase also. So the way I said before, you have a disease which is like diabetes or hypertension. With CML CP, what you need to have is a good adherence to chemotherapy medications, and this therapy doesn't have the usual side effects. You won't lose hairs, you won't have a lot of problems, you just have a few muscle spasms. Some of them can have skin changes, some of them can become white, so you are more like a foreigner. Some of them can have photosensitivity to the sunlight where they can become dark skin. So these are the only major side effects that they can have, and they can have a normal lifespan all through it. So compliance to the treatment and only stopping the treatment or discontinuation in between only with the advice of your oncologist or hematologist is what would be advised for the first phase, because you can lead a completely normal lifespan